We are live. Very well, welcome to all of you. Very good afternoon. This is Poonam from Secure Now. We have a Dr. Dharam Pandey with us. He's a senior consultant at Manipal Hospital, Dwarka. And he has more than 20 years experience in the field. So over to you, Dr. Dharam.
Thank you all. Thank you
Thank
all. And thank you everyone for joining. And today we are here live on discussion about ergonomics, work-related health issues, and I'll be talking about various aspects of ergonomics. What is ergonomics? What are the work-related issues we often face, and how we can prevent those work-related health issues. So I'm Dr. Dharam Pandey. I welcome you all on this session. I'm also certified with the in ergonomics and industrial health and occupational hazards. When we talk about ergonomics, see, a lot of people have heard about this word, a very popular term on internet, if you say, or in industries, particularly the administrative people, they often come across these ergonomic word. But do we really understand why this ergonomic is important? So as you can see on your screen that it says that this is not what I am saying. It is research and various evidence exist on the research and literature database that suggests that ergonomic reduces by 59% average musculoskeletal disorders, work-related, I mean to say. 75% reduction in lost work days. I mean, when people are not sick, they will not away from work place, or they will not take leave. So the more of work days, 53% reduction in restricted days. I mean, some kind of restriction in their work schedule. It improves the productivity of the people, employee or staff or anybody. It is staff means everyone, maybe the industrial worker, maybe an office worker, whatever kind of work you do, it improves your productivity by 25%, and that's a huge increase in productivity. It also improves the quality and an average reduction in the error we do at work, particularly in the industrial scenario, if we talk about, right? So it has a lot of benefits when we talk about ergonomics. But we will be discussing more focused on the office ergonomics and how we can prevent, how we can design the desk where we are working. And I will be also telling some of exercises which are, you can do it at your desk itself, and you can prevent the progression or maybe the adversity of work and work-related hazards, the musculoskeletal hazards in particular, right? So just move ahead. What, by definition, ergonomic is a science of obtaining a correct match between human body, work-related task, and the two. Now here, focus on these three words I said just now, that human body. So we are all human, and we have a human body, right? We have a body, and we always do certain tasks. Like, for example, somebody is sitting, writing, that's the task. Somebody is standing and doing some task, that is also task. I'm just sitting in front of computer and in a camera, and I'm speaking to you, and I'm addressing you, and I'm gathering online. And this is also, I'm performing a task online. And what tool I'm using here is a laptop, a chair, a table where I can put my laptop, the camera, the mic, the table, the chair. These are all my tools I require to have an online my online presence, and I'm delivering this talk to you, right? So ergonomics involve human body work a certain task, and there is a certain tools. Like for example, if an engineer or a person who is doing certain engineering task, then they might be using certain kind of tool in their hand, and certain screwdriver or some mechanical device they might be using. So remember these three terms: the human body, the task we perform, and we use a tool to perform that task, right? So these are three terms interrelated. Human body get injured while performing task due to wrong tool, right? Or the tools are right, but the task is being performed in a right, not in a right manner, how it has to be performed. Then there could be injury. Or the human body itself is not capable to perform that particular task, then also it get injured. So when we talk about these work-related injuries, that there may be problem at human body, there may be problem at the way we perform the task, there may be problem in the tool itself. Okay, right. So I hope you understood the concept right now. Let us understand in a greater detail. Human versus machine. Okay. Human body is also something like a machine. Machine works on the principle of mechanics, what we call it as mechanics. But here, human body also works on certain mechanics, which is called biomechanics. Okay, so when the tasks are performed in a wrong mechanism, wrong mechanics, then there are chances of more and more injury to the soft tissues. Like, for example, if you are driving a car and the wheel alignment and other things mechanically, it is not aligned, then definitely there'll be more and more wear and tear of your tires, and you might have some vibrations or some other issues in your car as well. So same way, in human body also, if your body is not aligned, if it is not working in right mechanism, right mechanics, it is not working on those principles, then definitely there could be some damage to your tendon, your muscle, your bone, or whatever the structure involved in performing that particular task. Okay, so try to understand the type of injury, how your tendon, your muscle, or your tissue get injured here. Okay, let me explain you in a better way. So you can see on your screen there are two pictures. One is an example of high impact injury, and the other one is called cumulative injury, which is what repetitive stress injury we can say. So here in this graph, you can understand there is a duration on one axis, and another axis is showing the impact of injury. Like for example, in first picture, if you can see that first graph, you fell down and you hit on the floor and you broke your shoulder, right? So that was very high impact injury, and within fraction of second you reach to failure point. And that what is the failure point is something which is damage being in place. Okay, there was some damage. Okay, so that means in a fraction of second the impact was so high that your tissue broke, you got a fracture, right? There was a damage. But in same case, like in work-related repetitive stress injury, this is the scenario is little different. Here, you have a micro trauma to your tissue. Like, for example, you are sitting here for prolonged time, you have certain abnormal pressure on your system, your spine, or maybe you are holding your mouse, or you are typing on keyboard in a wrong manner, in a backward posture, or maybe you are working in certain industries and you are not using the tool, or maybe the tool is itself is not in a right way. Like, for example, even the holding, if you are holding and removing something by in a kind of a screwdriver or some mechanical device, like which gives you continuous vibrations, these are all gives you a micro trauma. You hit your keyboard and thousands and thousands times in a day, right? You use mouse thousands and thousands times in a day. If you are working on computer, if you are working on desk and writing, you write and use pen for thousands and thousands times. So at that time, your tendon, your muscles, everything is stressed, and there is a load on those muscles. So there'll be micro trauma if it is get healed, and then it's fine. Otherwise, it will be giving repetitions. Okay, so ultimately, this will also reach to a failure point where you can see on your screen that this is also going to have a failure point. But what is the difference between before one and this one was is it is taking a longer duration, maybe in a 3 month or 6 month or year, maybe. And in a 1 year, definitely that tendon is also going to have some break, some damage, some abnormalities, and in the joint, in muscle, in tendon, whatever the structure is involved there, right? So this is how the mechanism of repetitive stress injury, the cumulative trauma, what we get due to the working and work-related repetitive stress injuries in human body, particularly in musculoskeletal and neuromusculoskeletal, I would say, the damages occurs, right? Let's move further. Okay, so that's the direct trauma, and this is the cumulative micro trauma example. Good. So now on your screen, there is some example of about ward postures. Here, one picture one, if you see there you can see that there is a leg is hanging, and the foot is not rested on the foot is not rested on on the floor, right? So the chair, the foot is hanging on the chair, and the back of chair is giving a pressure on the tissue behind the knee, and there may be some nerves which is getting stretched there. And if this is happening for a long time, then definitely that nerve or that tendon will get injured, and will cause and it will become a repetitive kind of injury to this particular thing, and it could give you knee pain, back pain, or whatever the symptomatology arise there. The second picture you can see, however, these kind of screens are not available nowadays, but I would emphasize that here, that it is related to something which is glare coming on your screen. You must have seen that those days are gone where the wall light was there. Now we are working in something yellow or dim light, so that it doesn't give you eye strain in days. And this is the example of development of science related to ergonomics, like how our offices are nowadays getting designed. Okay, so most of offices nowadays are well designed for these, and to address these challenges. So avoid glare. Here you can see that there is a glare on your screen, and that if it is in a repetitive manner and for prolonged, that it is going to have give the eye strain, the person who is working in such conditions. And the third picture example, you can understand that this gentleman has to reach out to his phone very far away. Okay, unnecessarily, he can keep this phone. So this is the example of the wrong way of using telephone. He is an executive who has to answer thousands of phone in a day, and I'm not thousand, maybe hundreds, but in a day, his repetitive task is to go hold the phone and answer it. Okay, so if he is doing this repetitive task, his tool must be in such a place, placed in such a place that he should not unnecessarily he stretch his shoulder so long, so that it could get stretched, and all the nerves and tendons are unnecessarily get stretched, and they are getting a micro trauma every day, thousands and thousands time. In a fourth picture, when you see here, so the chair height related issue here, where this lady is having a high shoulder, so that the small muscles here on sides of the neck get shortened, and when they try to relax the shoulder, it gives pressure on the back of neck, and that could cause neck pain. But you will not find any damage initially in any investigation or anything, but definitely in long run, if it is going on in that way, then you will have a damage in on your uh, neck tissue. There'll be more wear and tear of those tissues, right? So these are the few examples, right? So now you all guys may be thinking about this. I'm just making you afraid of doing jobs. So what is the solution? Should we stop working? No, it is not the way we think that we should stop working. You cannot, because you have invested whole life in certain career. And if you think that this career is like working in an office is very dangerous, no, it is not. Even if I'm sitting here and I'm as a professional, and I do any task, then I'm also at risk, and an engineer is also at risk, and a doctor is also at risk, and another person who's working at the labor is also at risk, and the board members and the bosses and the CEOs that are sitting whole days, they're also at risk. So whoever has bone, muscles, nerves, and tendons in their body, they are at risk to have and a work, and of course they are working, they have a risk of having work related neuromusculoskeletal repetitive stress injuries in their life sometime. Okay, so if they prevent, then definitely. But why I'm emphasizing how to prevent here is, it is always better to prevent, because most of offices nowadays in the modern offices are designed very ergonomically, and the only where we face challenges is I mean, there is a few terminology I'll explain, that the administrative aspect of ergonomics, there is a engineering aspect of ergonomic, and there is a human factor aspect of ergonomics. So we need to address the human factor is in a better way. Engineering aspect is related to the tools we use. So most of tools are ergonomically designed nowadays. That there is a designing team and other people. They are very well designing these tools what we use, and uh, the administrative issues, like this is the part of administrative issues, and the people are most of HR people, most of people who arrange this kind of educational sessions and ergonomics workshops, seminars to make people understand. So this is what we can call it an administrative way of addressing these issues. And the third is the human factor, where the two things are involved, like whether I am able to perform certain task, and if I'm not fit to perform that task, it is going to hurt me. And if the task is not fit for me, then also it is going to hurt me. So that factor has to be addressed, and that is the most challenging nowadays. Okay, so don't be afraid. We have solution for that, and to address ourselves and save ourselves to get affected with such kind of work related repetitive stress injury, or maybe you can call it as a cumulative trauma disorder. You may call it as a, work related musculoskeletal injuries. So there is a lot of terminology available if you search on internet the work related injuries, but everything is the same, where we get in a kind of micro trauma every day while working, and that leads to a permanent damage or some suffering in people. Okay, Rao. So what is the solution for that, and how we can prevent? So as on your screen you can see there are three things written: word, NEW. That new, very simple. I made it myself to make my people whom I teach these kind of webinars, and make them understand how we can prevent work-related injuries. So remember this new word, NEW. N stands for neutral posture. E stands for exercise and stretches, and W stands for workspace. How we work, how we design our work, how we sit on workspace, workstation, how we can arrange workstation. Okay, so let's move further. What is the neutral posture? Neutral posture is, if you can go by definition and understand what is the neutral posture, is the state of your body. I mean, I would say the neutral posture is that where you can utilize, your body is utilizing the minimum energy to function and to complete the task. Like, for example, if certain task is being performed in sitting, like this picture, if you can see, a person is sitting on computer and must be typing something, or doing certain tasks there, right? So if he's standing and doing, then definitely there'll be if his muscles are relaxed, and there is a less noise, and there is a proper elimination, everything there, then definitely he will have certain relaxation, and his muscles energy will be less required to function at this point. Okay, so we have to arrange the desks and place in a such a way that we can have a like you can see that the neutral posture is something which is requiring a less and less energy while functioning. So here you can see what is the neutral posture. You will find a lot of information on internet about a neutral posture, like how to set, how the shoulder to be placed, how much angle to be placed. Okay, so here you can see the ideal posture is your neck has to be in a straight. Your natural neck posture has to be in a place. You should not look very up or very down. Your eye level, your screen should be on your eye level. Your shoulders should be relaxed. Like, I mean, you're working with your hand, you're using your mind. It is not your shoulder which is working or typing. Your fingers, your wrist are functioning. So why you are using your shoulder while only hand and your finger can function? Okay, so every next thing is every joint has a neutral relaxing posture where muscles are most relaxed. Okay, so here in case of your shoulder, your elbow, it is somewhere around 80 to 90. I mean, more than 80, around 90 is the best one where you can keep your shoulder flags. I mean, you should not stretch your hand very far away and extended. You should not be keep your elbow extended and working. And this is most of people do mistake in this way. And it should not be more than 90, or it will give you stress on your elbow joint, and it will get strained, and other muscle has to function there. Okay, so same way it is at a knee as well. A knee also has to be in a way that um, knee joint has to be in a 90-degree flexion. Your foot has to be rested on the feet. If sometimes the people have an assault stature or very long, so if it is not, you have to not coming in a neutral posture while you are sitting on your chair. There may be some problem with your chair. There may be some problem with the related to human. I mean, I explained you three things. The tools here is the chair, human body is you, and the task you're performing is something sitting on chair and doing some task like typing. Okay, so there may be difficulty using that chair, so you have to modify to fit your job, fit your posture in a neutral way. Maybe chairs, so what you can do, if you are short height, then but the chair is right, but you are short height, then also there is a challenge, so you have to adjust in that way. So you have to keep thinking that where the problem is, this is the neutral posture, and I have to maintain whether it is me at fault, whether it is the tool is at fault. So identify that and correct that, then you will be have neutral posture, because it is not posture is not maintained conscious level, it is maintained at subconscious level, right? So if something is there which is hitting, like for example, if something is pushing from my left side, then my tendency will have to move on one side, so my posture will become bad in that way. So if something is pushing from back, I will come forward. Okay, so there will be feedback mechanism work while maintaining posture. So if my posterior muscles are weak and I'm standing, I'll start getting pain. If those muscles are continuously working, then I'll come forward and my body will slouch and bend. Okay, so I have to have a strengthening of my muscles as well. So that's what the neutral posture is, and we have to keep neutral posture while working all the way, and that will prevent the injury. Like here, the few of examples of bad posture here. So like here, you can see this is a shoulder, hiked shoulder. This lady is just sitting in a wrong posture, and she might have some kind of neck strain or neck pain later on. And this lady is sitting not well supported back here, so she might have a problem associated with repetitive loading and prolonged loading and prolonged fatigue of the back extensor muscles, lower particularly. And the same way, this gentleman may have some kind of neck pain, or maybe some thoracic pain here, or maybe some uh, elbow pain also. So this kind of example, you can understand whether you are sitting in this posture. So watch your posture and correct that. So you have to have a good working posture always at workplace. So I'll be teaching you some exercises now, but we will keep this for at the end, this exercise and stretch. Before that, I would like to explain you the workspace, how you can arrange your desks to minimize the risk at workplace. Okay, so the first thing, remember, you have to divide your workspace in three zones. Okay, so the green zone, yellow zone, and red zone. So what is these zones are? Okay, like for example, in your picture, if you can see, if this is this case, your workstation is here, right? So the green zone is something uh, which require only your wrist and your fingers are working, right? So what will you keep here? Okay, like the most frequently used tools in green zone. Okay, here you are not reaching, your shoulder is not involving, only your elbow and your wrist is moving like this and here and there, and you take mouse, you take a keyboard and start working. So minimal activity of uh, human body, shoulder and neck, okay, and spine and lower back. But the most frequently things and tasks you use and perform is your green zone. And in the yellow zone, the task which you perform at medium frequency. Like for example, every hours you need to have certain something which is like a file. You have to take certain reference. So you will reach out, take out the file, have some reference and keep it back, or maybe somewhere else you will keep it. Like for example, every hours, if you can have those references. So medium frequency work you keep in yellow zone. And what is in red zone? Red zone is something where it is beyond your arm reach. Okay, like for example, in green zone, I was not at all doing certain reaching activity. Reaching activity is far away, going far away. Okay, so I'm not reaching activities. Okay, I just use my elbow and wrist. But in yellow, I started using reaching activity. I involved my shoulder to reach out. Okay. In red zone, even with reaching with shoulder also, I will not get my tool or task. So I have to move forward to take it something or use it or do that task. I will involve my entire body to go forward, back, sideways, or maybe taller, like this, like how that gentleman was picking the phone because he used this hand, but again, he has to go that way and reach out to the phone. So that was the wrong placement of the tool. Why? Because he used to have performance repetitive task, holding the catching up the phone and answering that, but he has kept that in a red zone. But he used to perform that the activity of green zone. Okay, so the wrong placement you have to look at and arrange your desk in that way that it should not give you the micro trauma every day, which is going to have a permanent problem. And later on, like in a previous slide, I explained that how the cumulative trauma happens, right? So that's how you arrange your desk, right? Next, most important thing is after arranging the desk is following certain rules to make yourself more productive and more fatigable, right? So every day in the evening, you feel certain kind of fatigue, or maybe you become more tired, or maybe having some problem of insomnia or not getting sleep or some other kind of fatigue. So avoid that. There are certain rule which is called 20-20-20 rule. And what is this 20-20-20 rule is saying that every 20 minutes, at least uh, switch off your focus from the screen if you're working on your computer to look at somewhere far away, at least 20 feet far away, and stare that for at least 20 seconds. Okay, so that's what the 320s are: 20, 20, and 20. Okay, 20, 20, 20. So every 20 minutes, look at something, stare something 20 feet far away for at least 20 seconds. Maybe it is in a picture on the wall. Maybe it is in a flower pot on the kept. Maybe it is something you are looking at outside of window, or maybe it is anything. It could be anything except just staring your colleagues and your people sitting with you. So don't do that, right? So this why there is a reason why you practice this 20-20-20 rule is: first, it is going to relieve your eyes from getting strained while you are working on some visual display devices like a laptop or computer or some anything which is emitting blue lights and from brightness or something which is hitting your eyes, and you have to concentrate one. So first thing, it is going to avoid, you are going to avoid strain, eye strain. The second, you're going to minimize the visual display device associated headaches. Sometimes you get eye strain, and after that, you start getting headaches. Second thing, and the third thing, you are going to have, you are going to be more productive, because every 20 seconds, your brain is going to have some kind of rejuvenation, and within that 20 seconds it get revived, because brain cannot hold it something for very prolonged, and if you keep thinking you are doing certain concentration work, and something like, for most of time we do concentrate on certain tasks. If you relieve it for 20 seconds every 20 minutes, then your brain will work more efficiently. So in that way you will be performing, and you will become more productive, right? So there are numerous advantages of practicing these 20-20-20 rule, and a few of them I explained right now. And now I'm going to explain you certain exercises. Before that, remember that just like a car which runs more smoothly and requires less energy to go faster and further when the wheels are in a perfect alignment. Okay, then only it will be functioning more efficiently. Okay, so saying, you perform better when your thoughts, your feelings, your emotions, your goals, and your values are in well balanced. Okay, so try to balance your mental health, your feelings, emotions, and be focused to your goal, what you are doing, and keep certain values in place while working and in a personal life as well. And when you are balanced in that way, because you will have a less kind of stress, anxiety, because there is a lot of evidence which suggests that the mental health and physical health is interlinked. And when you are physically not well, you often fall in depression. You may have some anxiety, stress, and your mental health is also get affected. And it is the vice versa. If you are mental health is not appropriate, you may have sort of physical health issues as well. So it is most important to have to address both the thing together, right? Okay, so that's the thing. And there are few exercises here while sitting on the desk, and believe me, it will just take not more than 2 minutes, and at least 2 days or three times in a day at desk itself, you should do these exercises at workplace. So sit on the chair in that way, and just tilt your head in this way, like how this pictures is shown here, from one side, and then the repeat on the other side as well. The next exercise, look at the top of the roof without bending your body. Only neck has to look at. Okay. And then look at downwards. Okay. Look at the floor and look at the your at the roof of this. Okay. So do it for 2 or 3 times in a day. Okay. 2 or 3 times in once 2 or 3 times, and hold it for 10 seconds at least. Like, for example, if you're looking at top, hold it for 10 seconds and then slowly come back and then look at down. You will feel a stretch on your back, on your neck. Hold it for 10 seconds and then come to neutral. Okay. So this way, 3 to 4 times. Then again, here, this is a diagonal stretch. One arm is stretching upwards and other arm is stretching downwards. So in that way, you will get a stretch on your sides. Okay. So if you are pulling this hand downwards and this hand upwards, like you are trying with one hand, you are trying to touch the roof, and other hand, you are trying to touch the floor. So in that way, your spine will have something kind of a diagonal stretch. One side will stretch downwards and one side will go upward. And if you do opposite side, it will go in this way. So when you are sitting for a long time, do this for 3 or 4 times, and each time hold it for at least 10 seconds. Then simply you stretch your leg in front and take it back and try to touch it to your chest and hold it for 10 seconds and then relax. So do it for 3 or 4 times, this exercise as well. Then simply bend and try to touch your feet or the floor down in front and come back and look at backward. And this time you are putting your shoulder hand backwards while bending your back. Okay. And first exercise, when you are doing for neck, you are bending only neck, but this time you are not bending your neck, you are bending your body, your spine, your mid spine. Okay. And try to bringing your chest forward. Okay. So that will give you entire stretch here and a stretch on the back as well. And then you may find something here. You can just stand behind your chair, you try to bend, and you will have some feeling of a stretch backward here, entire spine. Don't bend here from your spine, bend from your hip. Okay, bend from your hip. So it will give you entire stretching from here to here, everywhere, and just stretch your front muscle as well and hold it for 5 seconds, 10 seconds. Do it for 4 or 5 times and 2 or 3 times in a day. And if you do this, then definitely there'll be every muscles you will take care, and you will stretch those muscles at the place, and these muscles will get more and more stretching and having safe blood circulation, better blood circulation, and more and more oxygen. When there is a better oxygenation, then definitely the chances of injury will be less, and these muscles will also be strengthened. So this is what in my presentation, and if there is any questions, then I am here to answer, and I'll be happy to help people to answer their queries here. So host, you, if any questions.
Sir, query I have put in chat box. Can you please check once?
Yes. Okay. Okay, Sudhir Nagesh, wife is on dialysis and she has recurring back pain in a lower side, below ribs are, and uh, what precautions should we take? See, I don't know how old your wife is, and she is on dialysis. Dialysis itself, a lot of nutritious and imbalance causes, and definitely she is on diet, then dialysis, then definitely must be in a patients of CKD. So there are a lot of diet restrictions, and a lot of there may be some of protein restrictions, or maybe some manipulation in diet where protein is less or more. So in that case, her muscles are maybe at threat, and the muscles are maybe weak. So try to make her in a better position, better posture, and she may have certain muscle strain and ribs area below sideways if you're talking. So just try to have some cold pack or hot pack, or some pain relieving non-invasive methods to relieve her. Have some gentle stretch on that area. If it doesn't help, then definitely you need to seek an expert opinion, and to have a physical examination and to address that. But definitely, I believe this problem could be sorted out, and if you meet a good physiotherapist in your area, he'll be able to release that area and have certain uh, intervention, right? Then the second one is asking how to improve foot drop and leg shortening. Oh my God. Look at this shortening. Why this shortening has there, and why this foot drop is there, we need to work out. Okay. So because without that, we cannot have comment, like, for example, it may be in after fracture, you must have got some nerve injury. After fracture, you may have some bone shortening, leg length shortening, or maybe you have certain neurological impairment. Because of that, your foot drop is there. So I don't know which is the cause, and without cause, it is very difficult to improve. But definitely, there are tools and modalities in physiotherapy and rehabilitation where we can improve foot drop, provided that what is the reason, whether it is reversible or it is a permanent. So having a consultation with a right person who can guide you in a better way, and physically meet them, consult them, so your problem will be solved. Rahul, muscle imbalance of shoulder exercise to cure it. Okay, definitely. This is a very, very good question for everyone. And Rahul is asking muscle imbalance of shoulder, and I should give exercise to cure it. The only cure for muscle imbalance is exercise, Rahul. And thanks for asking this question. So let me explain you why this muscle imbalance occurs. See, everything we do in front, okay? Everything we do in front, and we never try to have certain extensors muscle strengthening, and most of time our flexors is getting dominated, and sometimes our neck posture is also. See, shoulder is the joint where the only joint, bone to bone joint, is here, and other the bones are suspended through a bone called scapula, and there are a lot of muscles holding that in position. Okay, so from one uh, set of muscles which are coming from your neck area and from your ribs area, which is holding your shoulder blade, that is what called scapula. Okay, so one pair of your muscle is coming from your neck and your ribs, which are holding the scapula in place. Okay. And the second set of muscles, which are coming from the scapula itself and holding your bone, that is humerus, that is making the joint here with scapula to have a shoulder joint. Okay, so now you can understand the how complex the structure here nearby. Okay, so scapula is suspended through muscles from the neck and ribs, and then there are humerus is suspended through lot of muscles from the scapula itself. Okay, now there are number of muscles here involved in, and this is the most mobile joint where the movement is happening in every plane. Everywhere I can move like this, I can move like this, I can rotate this. So a lot of plane movements are happening. This is why the lot of muscles are involved. So most probably the front muscles, the bigger muscle, the tendency is the bigger muscles become more contracted. And once the one muscle is getting contracted, it is a natural phenomena, natural principle lies there, that the opposite side of muscle, which is called antagonist, will become weaker. Okay, so if the two people are pulling a rope kind of thing, try to understand the two people are pulling a rope, one people is stronger, so one people will start pulling more, this people person will become weak. Okay, so there are two muscles, and one, like for example, one is pulling this side and one is pulling from this side, it is pulling this side. So this is antagonist of this front muscle, and this muscle is antagonist of this. So when I'm doing hand like this, so this muscle is pulling my hand this side, so this muscle is becoming lengthened and in controlled way opposing this, so that it doesn't go in that way. Okay, so when this muscle becomes stronger, this will become automatically goes weaker and inactive. This is how the mechanism is where the muscle imbalance occur. So now answering your question now with having a thorough background, imbalance occur because your neck is in this way, so a lot of muscles become shortened. So that is one cause your shoulder imbalance, muscle imbalance could be. Okay, you're always sitting in slouch posture, that could be one posture where you have muscle imbalance in shoulder. Your pectoral muscles, maybe most of gym going people, they do a lot of chest, so their muscles become very tight, harder. They don't do it for your scapula muscle. Okay, so that causes muscle imbalance. Now the simple exercise for shoulder imbalance to strengthen the scapular muscle is to have just like this, and you squeeze your shoulder backward, like your shoulder blade in between, without, remember that this should not go up. You have to just like this shoulder blade two side, try to squeeze it and try to bring it together. Most of time people when squeezing this backside, they do like this. Don't do this. This is the wrong moment. Okay, it should not go up. Only you have to squeeze your shoulder. Okay, the second thing is lift your hand in this way and make like this. Okay, and squeeze and try to have this kind of activities up down. Okay, this kind of. Okay, you can do it on against a wall and squeezing that. And online, I can teach this exercise only. There are a lot of other exercises which can help to shoulder imbalance, but this is in general, this will prevent the imbalance. But definitely, if you need a specific uh, uh, care for your shoulder imbalance, then you need to meet an expert musculoskeletal physiotherapist to address your specific need, right? And now Lavina is asking, knee replacement surgery helpful, and doesn't that create an issue in long run? See, I'm not a joint replacement surgeon, but as of here, I can say that everything is on this earth, and the science has invented something, and something is going on, is having certain purpose. Otherwise, there is nothing useless and there is nothing problematic, or there's nothing is problem free on this earth. The only thing we need to understand is whether I need it or not. Okay, so if somebody is, the only option is the replacing the knee to have relief from the symptom, from the pain, and have a better quality of life, then definitely they have to compromise certain other things. Like, see, principal aim of joint replacement surgery is pain relief. So if your knee is anybody's who is thinking about joint replacement, and if it is causing, the pain is causing your to compromise your quality of life, day-to-day life, your physical activities are impaired, and you, more of that, you have tried other methods to get relief from pain, like physiotherapy, you have applied, you have found other mechanism of relief also, then you are the candidate for replacement surgery. Okay, and in long run, it is always, there are a lot of technology nowadays, and it is very good. mm, Implants, very good surgeons are there, and you can go ahead with them. But definitely indication is the most important, and you must understand whether you need it or not before trying other interventions. Directly going to that, I personally won't recommend that. You must try all the way to relieve from your pain. After that only you go ahead with the surgical interventions. Yes, Rahul, I have answered your question. Shoulder exercise to cure it. And any other questions if there? So I don't think any more query there. So thank you so much for listening to me, and I hope I have justified your time, and you must have understood well about ergonomics. And definitely, we do send your queries, or maybe whichever channel you are associated here. So thank you so much for watching this, and hope to join you again in future. Thank you so much. Thank you, everyone.